as children they know that school is coming around, so they want to go to the pool, they want to go to the lake, they want to go to the beach. And so that can present a danger because children from the age of 1 to 4, drowning is the leading cause of death. And for children 5 to 14, it's the second leading cause of death. And so the best thing that parents can do to avoid a drowning is constant supervision. That's the best thing parents can do. That
Thank you for joining us for another episode of Spotlight Houston, where we bring you the best of the people, places, and events in Houston. This week we sat down with Porfirio Villarreal from the Houston Health Department to talk about children's vaccines, water safety, and all the other programs that the Houston Health Department provides the Houston community. And now your host, Blanca Quesada.
Hi, and welcome. Today I have an amazing friend here with me, and he's going to talk about health services. A lot of people in the community, especially our culturally diverse community, is in need of health services, and sometimes they don't know who to turn to, maybe because they're low income or for whatever reason they don't know who to reach out to. And so I'm going to be talking with Porfirio Villarreal. He is the Public Information Officer for the Houston Health Department. Welcome, Porfirio.
Thanks for inviting me. It's a pleasure to be with you and your audience.
Well, it's great to have you here because the Houston Health Department provides many full service benefits. You provide all that support that people in low income communities might need, and mothers and fathers and children and elderly and just everybody in our community. So today we are going to focus a lot on children, and right now parents are kind of wondering what they're going to do to get all their kids back to school, and those new parents that are just about to get their kids in school, they're wondering what all do they need, right? So many people mistakenly believe that children need their vaccines or shots right before enrolling in school. However, I know you had mentioned to me before that vaccines begin at the time of birth. So can you kind of explain a little bit about that?
Yeah, vaccines are one of the greatest scientific accomplishments that we have because they keep us safe from many diseases. So when we think about vaccines or shots, how they are known, you want to think, parents need to think about when a baby is born, it has that immunity that the mother passes to that child, that fetus, while it's developing. But soon after it's born, a few months after, then that immunity, those defenses start to lessen and they wane after a few months. So that is the time that you want to make sure that you give your child the vaccines that it needs. And basically, those shots, those vaccines, make the child able to fight off diseases. So basically, you're making the child stronger, able to protect themselves just like the mother has because she has vaccines. So that's how you want to think about it. And yes, a child will need, by the age of 2, 80% of the vaccines that he or she will need through their entire lifetime. So those first a few months are critical to making sure that the baby is healthy.
What diseases do some of these vaccines prevent?
You have hepatitis B, diphtheria, tetanus, pertussis or whooping cough, influenza type B, pneumococcal disease, and then polio, measles, rubella, varicella, and hepatitis A. Those are the most common. And of course, recently we've had to children have their COVID vaccines, and also this coming year, there's going to be a shot for RSV. We had a triple demic this past year, so that's some. Those are some of the most important shots. But parents don't need to learn all that or have all that. If they just take their child to their doctor or their medical home, then the doctor will make sure to give those shots at the age that is appropriate.
You mentioned RSV. What is RSV?
RSV is this virus that affects mostly the young children and also the elderly. So it's a disease that really makes it hard for children to breathe. They end up in the hospital. It's flu-like symptoms, and it could be severe in some cases, and babies can end up in the hospital. So you want to make sure that this coming year, if you have a child under 2, when they go get their flu shot, they also get the RSV shot.
Oh, okay. So it's a prevention vaccine so that kids can breathe and the elderly can breathe as well, basically.
Yes, it basically, we need to make sure, because it is a new circulating virus, that they are protected. So that's why we want to make sure that they all get the vaccine, especially coming in this coming year, because like this past winter, we had the COVID vaccine that needed COVID going around at lower levels, but still going around. And we had a hard flu season and also RSV. And so that makes it really hard on our healthcare systems. And so then they end up having too many people at the hospital, and can be hard to have so many patients and so many beds filled with patients. And it's, once you have so many, then you have to open up new beds, and it's a hardship on those hospitals. And we want to protect those hospitals because you always have accidents, other illnesses, and so you want to make sure that you have a low census so everybody can be safe for whatever reasons they end up in the hospital.
Well, Porfirio, it sounds like it's a lot of vaccines and shots for kids. Can they get them all at the same time, or do they have to be getting them at a specific age?
Yeah, so when at the start of life, when the baby is born, before they leave the hospital, you have the hepatitis B vaccine. And then at 1 month, 2 months, 4 months, 6 months, at a year, and then at 15 months, it's a series of doctor's visits. And so at 2 months, they have the diphtheria, tetanus, pertussis, or whooping cough, the influenza type B vaccine, which causes kind of a pneumonia type illness, and then also the pneumococcal vaccine and polio. And those are similar at 4 months, 6 months, and then 12 months. And so by the time the baby is 15, 18 months, then they get, like I say, about 80% of the shots that they will need in their lifetime. And then what happens, then you have a period of from 2 to 4 years where there are no vaccines needed except the regular flu shot every year, and the COVID. And then when you get to 4 to 6, then there's a new vaccines to update the child, make sure that the immunity does not fall off. So it's a booster shots basically from 4 to 6. And most people think because it happens from 4 to 6, it's back to school time. So that's why the notion that it's back to school, but really it's age that dictates when a child gets the vaccine. So, but I know it sounds complicated, but the best thing to do is whenever a child needs to go to the doctor, just ask their doctor, or does my child need to be updated with any vaccines? Maybe the child is there for an illness or a broken arm, or for whatever reason. So anytime you go to the doctor with your child, just ask, is my child up to date? And that'll save a lot of problems. You don't need to know all these vaccines or the schedule. Just ask your doctor. That'll be the best.
Yeah, it's kind of overwhelming.
It can be, but you just have to think about it before 2 and then 4 to 6 and 4 to 6. Just make sure those ages are really important to make sure that babies and children are the strongest possible to fight off those diseases that are circulating. Because some parts of the world, you have a lot of diseases that are circulating at a much higher rate than we have here in the United States.
Yeah, actually, I was going to ask, that there are so many people from different parts of the world here in Houston now, and they may have some misconceptions about the vaccines and shots that their kids might get. And so they're fearful of having to put their kids through this.
Yeah, there are some countries that have high immunization rates, even higher than the United States. But there are some other countries, especially those with poverty, that may not have the immunization rates that we have here in the United States. It is a barrier, and we live. Houston is a very worldly city, so you have people coming from all over the world. People from the U.S. go other places, faraway places, and they could come back with an illness, and so you always want to make sure that you get the most protection from vaccines. And like I say, they're one of the greatest scientific inventions in human history.
Yeah, and with Houston having such a large medical community, the medical center downtown, and so many other doctors and medical facilities around Houston, people should feel maybe reassured that this is a place to be if you want to be healthy and you want your kids to be healthy and well.
Yep, it is. And one of the things the health department also does is we provide vaccines to about 500 private doctors or doctors out in the community in those areas that are disadvantaged. And they provide the shots for free to children who need them and who live in these underserved communities. So, and we keep tabs on them, on those doctors. We make sure that they're patient caseloads have that those doctors are giving the shots to those children. We audit them and we give them vaccines, but we also audit to make sure that there are more opportunities to vaccinate, even in those communities where they may not be close to that medical center. We have a great medical center, but there are some of our parts of our community that it could be might as well be 1,000 miles away because they're in underserved communities and there's lack of doctors in certain parts of town. So those 500 doctors all over the county that we give those shots help the health department make sure that children stay safe in their home and in their communities and at school.
Yeah, and a lot of people also might not have transportation. So it's important that they realize that they can get health care for their kids and maybe even for themselves. I know you go out to a lot of community centers as well.
Yeah, we do go to, we have our health centers and community centers, and sometimes we do get invitations, for example, to events and such. But our main message to parents is don't depend on a health fair here, an event here. Establish your medical home because that's your doctor needs to know exactly your medical history. And that doctor at a health fair or that nurse at a health fair is not going to know the child's medical history. And that's important. That way they know what to give the child. And also, parents will forget, okay, maybe I already vaccinated my child with the polio shot. And then you're giving the child another unnecessary polio shot. Nothing's going to happen, but it's over immunization. You don't want to do that. So best thing to do, go establish a medical home, go to one doctor, wherever you feel comfortable, as long as you have a doctor that knows your medical history and will take opportunity to vaccinate you and your child whenever they show up to that office.
Yeah. Or they accidentally misplace their records.
Now, well, a few years ago, the state started an immunization registry. So now parents can opt in to this registry, and it's basically an electronic medical record. And anytime their parent can check their records, they'll just ask their doctor, okay, pull those records up. Is my baby up to date? Is my child up to date? So they don't necessarily have to keep a copy at their home. It's a good idea, but it's not necessary now with the immunization registry. If they sign up, they agree to participate, then they're set.
Well, that's great that you're giving out this information because a lot of people might not realize that they can call and get information on their health care, whatever they've
Yep.
received. Yeah.
Yep.
So, what else is it that children need or parents need for their children to be able to get into school safely?
Well, that's one of the important things. Also, if parents are have a child that will enter the school for the first time, they are going to need their birth certificate, and the health department provides the birth certificates for children born in Texas. So if you're born in Houston or any other part of the state, the health department is able to provide that birth certificate so you can enroll your child in school. So that's really an important thing to do, especially since we're getting right now close to the start of school. It's important if you are enrolling your child for the first time to get that birth certificate and make it easier transition into enrolling
Well,
your
how can
child.
someone get that birth certificate from the Houston Health Department?
There are two ways to get the birth certificate. You can basically, the easiest way is to order online, and also you can also go in person to our main offices at 8000 North Stadium. For online, you can visit houstonhealth.org,
And how
and you
long
can
does it take to get the birth certificate?
it depends how soon you need it. For example, if you don't need it right away, you can order online and it'll be sent mailed to you, and you'll receive it after about 4 weeks. It's the processing and then mailing it out to you. Now, if you need it the same day or sooner, you can order online. If you order online before 2 p.m., it'll be ready that day. So if you go to houstonhealth.org, you place your order before 2, you'll receive it that day. If you order after 2 p.m., then it would be ready the following weekday by 10 a.m. So that's two ways you can get it.
Yeah.
Or you can just show up to our 8000 North Stadium site, and then you can just show your ID, and you're there to pick up your birth certificate for your child, and then you'll pick it up.
Is there a fee?
Yes. So there is a $23 fee. If you don't need it right away and it's going to be mailed to you, they add $3. So it'd be $26. If you need it the same day, you add $15 to those $23 for the fee for the birth certificate, and it'll be given to you within the same day, basically.
Yeah. Well, with Houston's heat being over the top, so to speak, there's a lot of kids that all they want to do is be in the water, especially if they have a swimming pool in their homes or in their community center. All they want to do is just be in the water. And what is the best advice you can give parents to reduce the risk of children drowning?
Yeah, as children they know that school is coming around, so they want to go to the pool, they want to go to the lake, they want to go to the beach, and so that can present a danger because children from the age of 1 to 4, drowning is the leading cause of death, and for children 5 to 14, it's the second leading cause of death, and so the best thing that parents can do to avoid a drowning is constant supervision. That's the best thing parents can do. That means a parent is not looking at social media, washing a car, reading a book, is just really constant supervision, because children can drown in a matter of seconds, and if they're not looking and it's quiet. And so that is really a tragedy when a parent is close by but does not notice that their child is in trouble. And so that constant supervision is the best thing. It has to be eyes on children all the time, especially if they're the younger ones, especially under 4. That's really important.
Yeah, don't assume that your kids are going to be safe just because they're a little bit older. You have to keep an eye on them, like you said.
Yeah, and if they could slip if they're running around and fall into the pool, if there's a pet nearby and accidentally pushes that young child to the pool, that can be a problem. If a child decides to dive into the pool, the shallow part of that pool, then they could injure themselves. They don't know how to jump into the pool correctly, which is you dive with your feet first in the water, not your head.
Mm-hmm. Yeah, that's true. Kids get really excited and they're not thinking and they don't understand that there's so many ways they can hurt themselves in the pool. They
That's
just
right.
want to have fun.
Yep.
So, when should children learn how to swim?
You want to make sure that children enroll in swimming classes once they turn 4, and that there are qualified instructors who can teach them how to swim correctly. Children under 4, just because they take the swimming classes doesn't make them drown proof. So after child is 4, that's when you want to make sure you enroll them. There are some classes that, for example, that teach life-saving self-rescue techniques that prevent drowning. But really, swimming after 4 years of age, that's the key.
Mm-hmm. And what is it? I mean, I know that a lot of parents, when you're talking about children under 4, there are a lot of parents that will go out and they'll buy these little plastic small pools for their kids. But is there a danger there if people or their parents aren't watching them?
Uh, yeah, if you want to make sure that you still a child can drown in an inch of water. An infant, a toddler, can drown in as little as 1 inch of water. So again, the constant supervision, you want to make sure that you're with them. And once you're done with that small plastic pool or an small inflatable pool, then you drain them. You don't want to leave that water in the pool in your backyard, because the next day or after, or if it happens to rain and it fills up, that's a danger, because your child may be playing, and if you don't know that they're outside, it could you could have a drowning.
Yeah, they easily run out of the house without you realizing they've gone out. And like you
Yeah,
said, if there's a little pool full of water, they're going to jump
yeah,
in. And if they don't know how to swim because they're too small, then they may end up drowning. The other thing, too, I think that might be important is where you put that small pool. But it has to, I think the area has to be clear of little stones and rocks and on a soft grassy area if you have a grassy area.
yeah. That's an important point. And then once you pick that point, you that's best spot. And then once the fun is done, then you put it away. And also, the same thing goes for buckets. If you have toddlers and you leave a bucket out in your backyard, and a toddler, a child, that can happen. A drowning can happen in a bucket, or even if you leave a bucket in a shower or a bathtub, that's also a danger.
Mm-hmm. Yeah. And a lot of people live in apartment complexes. And who can they report an issue with their pools and in their community? A lot of people have safety concerns. Who can they report it to?
Yeah, our department, the Houston Health Department, does have inspectors. Their sole job is to inspect pools at apartment complexes or HOAs. And so, if there is an issue or you feel something is not right, then you call 311, and then that complaint or that information filters down to our inspectors, and they go out and inspect, and they look at that pool. Is the water clear? Is there a one of those long poles to get somebody who's in trouble, pull them out of the water? Is there an emergency phone nearby? Lots of things that they look for to make sure that the pool is safe. They look for also that those gates, they're self-closing, and once they're self-closing, they also check if it's latching. You don't want a small child to just walk in. If it latches, that's when you protect child. They also look, for example, if there aren't any objects or chairs or anything by the fence, that they can just climb on top of whatever is nearby, a box or a chair, and then they climb over, and then they end up having an accident and drowning. So that's another thing that they look for. So just call 311. If it's in the city of Houston, our inspectors are able to cite them if there are unsafe conditions.
If nothing's being done, should people call the police department?
What happens is when there is a complaint of a pool that's not maintained, or there's a health issue, or there's health safety issues, then our inspectors will issue citations. Once they start issue citations, if the apartment complex or HOA does not uh, fix the issue, then it goes up to a municipal judge, and the municipal judge can fine them $2,000 a day if they're not fixing the issue. So that's how it's addressed.
Yeah. And there's so much more that we could talk about, but I want to make sure that people also know that the Houston Health Department has a lot of other services as well, a lot of educational programs, and it's not just for little kids, it's for everyone, including senior citizens, right?
That's correct. So the Houston Health Department has the Area Agency on Aging, and that covers the entire county. We're funded through the federal government to provide services to people 60 and older. So a lot of things we do is benefits counseling. For example, if people need assistance enrolling in Medicare, if any other programs such as Medicaid, or if there are issues, for example, seniors may be in nursing homes. And so we have a program where we have ombudsman program where there is someone who advocates for their rights and makes sure that everything is correct, that they're not being neglected. Also, there's a a program where there's offered respite. In other words, there are people who go to that senior and their caregiver and give that whoever's taking care of them, that caregiver, a little respite, a little break to do other errands. For
Mm-hmm.
example, if that caregiver has to go to the pharmacy, grocery shopping, their own medical appointments, then they're able to assist and sit with those people 60 and older for some time during the day. That way, their caregiver can take care of doing other chores.
Do they have to be in a low income community for them to get this
No,
care?
it's yes, it's mostly benefits the low income people, but it is for anybody 60 and older, anybody that has a disability. They also benefit from the area agency on aging.
Oh, okay, great. So, Porfirio, what else do you consider to be one of the most important things that you want people to know about the Houston Health Department?
Well, we have close to 70 different programs, and we could spend all night talking about them. But I think if they go to our website, houstonhealth.org, they'll learn about the many different programs that we have. So basically, we have our health centers, we have our multi service centers. Multi service centers are just buildings where we provide office space for all these different programs in the community, and it may be a clothes closet, a literacy program, a meal site for seniors, a daycare, and all these other agencies may help with the clothes closet, any other type of needs in the community. And so they're at our multi-service centers, and that's important. We also have a lot of environmental programs. So one of the big things that we do here in Houston, we have more than 15,000 restaurants. And so they've got to be inspected to make sure that people who go out and eat do not get ill. And these inspections are everything from your gas station that sells packaged foods or hot dogs to really fancy, swanky restaurants in high upper neighborhoods. So we make sure that food is safe to eat, that they're following the safety. So that's really important. Another thing that we do is we monitor the air for pollution, and our uh, readings, our monitoring, it goes into the state system, and then that's how you get the ozone alert, air pollution alerts, the asthma alerts. That benefits people in our community. And also, we do, aside from inspection of pools and apartments, we also inspect the apartments. For example, if there's an unhealthy condition in apartments, you can also call 311 and we'll go if there are apartment complexes not dealing with pests such as rodents, roaches, insects, or any other thing, or there's moisture that's causing mold. We'll address it. We'll cite them as well if they're not addressing the issue, or anything that is unsafe to health. We'll issue a citation for apartment complex. And of course, we enforce the no smoking ordinance that the city of Houston has. So those are some of the kind of more important programs that we have, or I'm thinking about right now.
Yeah, because you have a lot. You mentioned there's 70 different types of programs and ways that people can find out about different health issues and how to get help. And it's just amazing what the Houston Health Department can provide our community. So I want to thank you so much for being here and for just all the information that you've given us.
Oh, thank you for inviting me. It's a pleasure.
Yeah. And of course, as always, I'd like to thank you for being with me for this edition of Spotlight Houston. And if you have any comments or if you happen to have any story ideas, please let me know.
Sure will.
Thank you for joining us for this episode of Spotlight Houston, a production of Story Zone Media.